Welcome to the Nurses Out Loud radio show. We will be starting in a few moments, so please stay tuned. If you are watching on social media, please give us a like, share, and follow. And for those of you who would like some more info, please go check us out at nursesoutloud.com. Thank you.
When we discuss pharma scandals here on Nurses Out Loud, we look for patterns with our audience because we see the same playbook being used over and over. And that playbook is used to promote products as being, air quotes, safe and effective when they are anything but. The medication class in the crosshairs for this episode is statins. You might expect an in-depth discussion about the complex risk-benefit analysis of this incredibly common type of medication. But I am going to skip ahead to the punchline. This entire medication class is a grift. It is fraud on top of fraud going back to the 1960s. But how did we get here? How did we get to a place where the most educated people in our society are handing out prescriptions for statins like candy? Literally the most prescribed medication class in existence, if the entire premise of cholesterol-causing heart disease is an easily identifiable fraud. That question is what cardiac nurses Nicole and Ashley are going to help me unpack today. Nicole, Ashley, welcome to Nurses Out Loud.
Hey, Dave.
Thanks for having us.
So the three of us together, we established in a previous episode about credentials, are all anti-science, dangerous conspiracy theorists who are a danger to our patients and our coworkers and our communities. We're supposed to open up episodes by listing all our credentials and experience, but that is a bit of a fallacy that gets people in a lot of trouble, and those appeals to authority have been doing a lot of harm. All I have to do is mention the name Anthony Fauci, and so many people get a visceral reaction to that. But hey, that is a person who was put up on a pedestal as this incredible authority. I don't want to open up that can of worms or go down that rabbit hole, but we're trying to figure out new ways to introduce ourselves here on Nurses Out Loud that kind of challenge that establishment system of offering your credentials and that being, your authority to speak on that topic. So give us a listen, and then you make your own decision after you hear what we have to say. And by all means, fact check us and reach out. You can go to nursesoutloud.com to interact with the nurses. You can look us up on social media. When I say us, I actually mean them. You can't look me up on social media anymore because I deleted everything recently. I decided that I am no longer going to spend any of my valuable attention on companies who hate me. So Instagram is gone, Facebook is gone, Reddit is gone, Netflix is gone. What else? There were some other ones in there that I barely used. But yeah, I'm on X and I'm on Rumble, not because they're perfect, but because they don't just overtly hate me. They don't censor quite as much, and they uphold my values far more than those other platforms. If you want specific examples, you can look back on episodes where we've talked about the incredibly predatory behaviors on children that is allowed on platforms like Meta, Instagram, etc. All right. Back to statins. Sorry about that. I'm just taking this topic off the rails, talking about social media and Fauci and just all my usual soapboxes. Let me pass it over to Nurse Nicole for a second for some opening remarks here.
Yeah, so as a nurse who's always worked in the cardiac field and taking care of cardiac patients, statins, I am no stranger to statins because in order to meet our CMS guidelines and to usually follow accreditation practices through the American College of Cardiology, they require certain medications to be ordered for patients unless there is a contraindication or the patient refuses. And so in order for hospitals to meet criteria, meet compliance, and also get reimbursement, they are told to follow the protocols of when a chest pain patient or a cardiac patient comes in, that a series of medications must be ordered. And statins happen to be one of them that, straight out the gate is ordered, even for people that when you run their panels, their cholesterol panels, you kind of question, why the heck are they on this when these numbers really aren't too bad? And so a lot of the times they'll be like, well, it's prophylactic, or, oh, we're trying to protect you from a heart attack or a stroke. And, they feed this facade to the patients as this is an all good thing. Like, this is going to protect you and you're going to be safe and they are effective, when really they fail to mention and provide informed consent that we know there's a lot more potential adverse outcomes and harm that can come from these medications that most patients, unfortunately, don't find out until they start taking them and realize, OMG, we're in trouble, SOS. And the rest is there. So we can talk about that more when it comes. But that's my initial thoughts. It's not uncommon. Everyone's being put on it. It is literally like Protonics or pantoprazole, baby aspirin, like we're just giving it out like candy. So it's unfortunately something a lot of people have been put on and told it was good.
Yeah, there's roughly 200 million prescriptions for statins written every year in the US alone. They are by far the most common medication. The only one even close is blood pressure meds, but they lag behind by tens of millions of prescriptions per year. So it begs the question, if the two most common medications by far are both heart medications, why isn't heart disease getting better in this country? Why does morbidity and mortality from heart disease keep getting worse if these drugs are so miraculous? Ashley, do you have any theories on that question?
I have a lot of theories, but I guess they're not theories. It's like conspiracy fact, right? You go into them, and then the next thing you know, the whole show has gone by.
You've got conspiracy facts. I like that.
I've got conspiracy facts. Yep. It was a really big struggle for me working in cardiology. Like Nicole said, I was constantly giving these medications, and my patients were coming in and they were telling me how they were having such bad side effects. And I would just watch them get bullied by the physicians time and time again. Core measures came out, which is what Nicole was talking about with CMS. And so, this is the protocol that we put people on because it's best practices. And we go back into that, trust the science, trust the authorities again. And it was really frustrating to me. I remember very distinctly, my dad was being put on some of these medications and I was taking care of a patient. And while my dad's cholesterol is not great, I had a patient who's like, my cholesterol is fine. I don't even need this. They were educated. And I'm like, oh, you're right. Why are you being put on this? Like, is there not an exception? And I was like trying to advocate for a patient and got chastised. This is part of the protocol. If we don't do it, we're not going to get reimbursed. And I'm like, well, that's not a good enough reason for me. Like, that just doesn't cut the mustard, And I'm sitting here going, what are we doing? And then I'm looking at the side effects and I'm looking at what patients are complaining about. And I'm looking at these inflammatory processes. And I'm like, what did we just do?
Obey the authorities, Ashley.
I've struggled with that my whole life. Imagine
protocols. Yeah. This is the standard of care, all that sort of thing. It's okay. Where to go with this? Should we go back to the beginning? Should we go back to the 1960s with Ansel Keys? I mean, the premise here is that cholesterol causes heart attacks, therefore cholesterol is bad, therefore medications that lower your cholesterol are going to be good for your heart. That's a very simple premise, and it makes logical sense if it's true. So is it true? You know what it reminds me of? It reminds me of all the episodes that we've done on antidepressants. This is a red flag to watch out for as you're trying to discern truth in all these things. And that's reductionism is marketing. Keep an eye out for anything that seems overly simplified, and the answer is a pill. The answer is really, really profitable for someone. Reductionism is marketing. So with antidepressants, it's depression is caused by low serotonin. As we've discussed at length, there was never and still is not any evidence supporting the hypothesis that depression is caused by low serotonin. But we have an entire class of medications that cause disruption in the serotonergic system that are called, air quotes here, antidepressants. And we give them to people for depression, but it was never true. It was always marketing. It was incredibly effective marketing. I mean, it changed us as a society. We started to think of serotonin as the happy chemical when I just looked at a nursing textbook last week. It was a psych nursing textbook, and it had a section on serotonin, and it said serotonin is found in your brain and spinal column. It didn't mention that 90% of your serotonin is in your gut. Didn't touch on that at all. It just, this propaganda is out there, and it's been out there for so long, and all these people who prescribe things like statins and antidepressants, they are some of the most propagandized people you will ever meet. And people who ask questions like Ashley, they get squeezed out of this system. They do not become doctors. They don't make it through medical school if they are challenging their preceptors. They definitely don't make it to the head of their department. They definitely don't make it to a position of authority at the FDA or something like that. If you rock the boat and you ask these questions that challenge establishment power, it is career suicide. We've seen that over and over. So to circle back again, the pattern to watch out for here is reductionism. Here, the reduction is cholesterol causes heart attacks, therefore cholesterol is bad, therefore you should be on this medication that just so happens to generate billions of dollars in revenue for a corporation that has been convicted of felony fraud and racketeering over and over and over. So is that true? Is cholesterol the cause of heart attacks? Well, we're going to go back in time to the 1960s and a doctor named Ancel Keys. There was a lot of buzz in the United States because former President Eisenhower had a heart attack, and more people were having heart attacks. It was becoming one of the leading causes of death in the United States, and it was something that was relatively new, and people wanted answers. So there was a doctor who did a study called the 7 Countries Study. His name was Ancel Keys, and he determined, he was a adamant believer that high-fat diets cause heart attacks. And this study that he put out was very convincing because he compared these countries, and the ones who ate more fat had more heart attacks. And fast forward, here we are, 2025, and that is still what people believe. He completely villainized cholesterol as being the source of these heart attacks. And the problem is, it was never true. The problem is he committed research fraud. He had all these countries who ate high-fat diets, who had low amounts of heart disease. People were not having heart attacks, and he just excluded them from his study. He was a true believer in his hypothesis, and he just got rid of the evidence that contradicted him. He had a huge personality. He was incredibly charismatic, and he was a force of nature in the institutions that he was a part of. And so he was able to push forward along these lines in a way that still reverberates in this country today. And you know who it reminds me of? It reminds me of all the villains of COVID. It reminds me of Anthony Fauci, Peter Marks, Peter Hotez. It reminds me of Rochelle Walensky. It reminds me of Bill Gates. It reminds me of all these people who are far more interested in their own ego, in their own narcissism, than they are interested in truth, than their interest in evidence-based medicine. And we apparently have not learned this lesson and made the necessary adjustments within our federal institutions, because here we are. This issue, not only has it not resolved, it's probably only gotten worse in the time since Ancel Keys pulled off this this wasn't even a sophisticated fraud. It was actually pretty easy when you looked into it. Like, oh, this is BS. Maybe we shouldn't be structuring our entire food and medical system around this hypothesis. So, Ashley, thoughts on where we're landing here?
I feel like it's just repeat, how do we shift people's mind, though, when this is something that's so ingrained? This is such an old concept. Back then, people were so honest and good, and it was before medical corruption, and I feel like that's where a lot of people, and I'm not necessarily talking about medical professionals, but like the layperson out there, this has been known forever. This isn't new. The science is settled. How do we start to reverse that? How do we, go against that? And then there's the whole idea of the fact that you bring up reductionism, and that's exactly what it is. What am I going to do if I don't have my statin, Dave? I'm going to die of a heart attack. And that's a very real struggle that I went through when my dad was dealing with all his heart issues. If I don't do this, then am I responsible? Well, am I telling my dad not to take a statin and then he's going to croak because he's already had a 5-way bypass, but he was on statins anyways? So I think that's a big part of it is we always have to provide education and information to support and go along with as we're trying to expand upon, or how do you even say that? Like eliminate this reductionism, expose that, reinflate the brain, because the brain is, cholesterol. Let's put that cholesterol back there so we can start thinking again.
Luckily, there is an enormous amount of resources out there on this topic that just blows this entire medication class out of the water. Regarding Ansel Keys, there's an excellent book that came out, it's like 2012 or something at this point, by Nina Teichels, and the book is The Big Fat Surprise: Why Butter, Meat, and Cheese Belong in a Healthy Diet. She unpacks all of this about how we got to where we are today, talks about Ansel Keys and his conflicts of interest and the American Heart Association and the way our federal institutions got captured and the way that big food and big pharma were involved in all of this. And if reading books isn't your thing, you're listening to this on podcast. So if you would rather listen to a podcast about it, Nina Teichels was recently a guest on the Dark Horse podcast, interviewed by Brett Weinstein, and they had an excellent conversation about it. Other resources include any of the carnivore doctors. This is the very first question that comes up when somebody says that they're on the carnivore diet, like, oh, you're going to die of a heart attack from all the fat that you eat. It comes up over and over and over. So look up Dr. Ken Berry, or another great carnivore doctor is a heart surgeon, literal heart surgeon. His name is Philip Ovadia. He's got a book called Stay Off of My Operating Table, but he also does podcasts and he does social media and that sort of thing. And just go look at some of his content. The things that these doctors share is mind-blowing. And the reason I have so much respect for them and that I am quick to listen to them and to trust them is because they have completely changed their mind and acknowledged that they were wrong. And like Ashley always says, once you know better, you do better. They're out there doing better, and they are out there having incredible results with their patients when they discard this oversimplified notion that cholesterol is bad and therefore statins are good. Nicole, thoughts?
Well, being in the field for a couple decades now, I've witnessed what the bar of cholesterol, good cholesterol, bad cholesterol, the when I say bar, meaning the level, has fluctuated and changed to be lower and lower and lower, and how they consistently try to drop what is considered healthy or safe, and how that has increased the amount of people being put on these statins and these medications that they are saying have to be had in order to stay healthy and prevent. And I think one of the things that could help us in trying to educate, right, is just like you said in the beginning, like heart disease is the leading one killer in the United States. Now, there's a lot of things that people are probably going to say about that, our diet, the soil, like how we grow our food, the fast food, all of those things, the lack of exercise and all that. But the root of it is that the physicians aren't asking those questions usually. They're just going directly like, oh, what's your blood work? Okay. And then just saying, okay, we're going to order these tests, which are most likely going to find something by default, which brings you back in as a patient to continue to be in the cycle of sickness, and then prescribe you medications like statins to say that this is going to be what helps you get out of that cycle. And they may mention diet a little bit, they may say a little bit of exercise, but the pill is really the focus of trying to get you better, as we see now with the Ozempic pandemic crisis and all these people who can't lose weight or having a hard time. So here, just take this injection. Don't really worry about doing the work. Let's just take this. And so I think it's just really continuing to have those conversations that it's not just pharmaceuticals. And one of the things with the $70+ billion handshake with the devil that Trump just did with Pfizer to produce more pharmaceuticals for things like obesity, cancer, etc., we're just feeding more into the pill. There's nothing else conversation wise a lot of people are doing. And I think sometimes that's part of what's waking people up, is like, there really is nothing else that I can do, or there's nothing else we can focus on to better how I'm feeling. It's just continuously adding pills. And I think that's waking some people up, not all, but enough to where people are like, yeah, I'm just not going this route. I'm not trusting it. I don't feel like, that's always the best route to go. There are people that do need pharmaceuticals, but for the most part, it's not the majority. There's other things that I think we can do. And it sometimes gets them confused, and why so many people that we take care of in the hospital are on 10, 15, 20 pills. Like as a bedside nurse, that is what you see. It's a pill for a pill for a pill, causes a side effect. So take this pill. And it's just all these pharmaceuticals, and these patients are not getting better. They're getting sicker.
They are getting sicker, and it's a problem with many different layers because so many people don't actually want to change their diet. They don't want to change their lifestyle. It's too hard. They're too entrenched in their habits, and so they just want to take a pill and be like, oh, there, I took my statin, I'm going to be fine. And if they are motivated enough to do something like change their diet, the diet that they're going to be told to eat by the American Heart Association or the American Diabetes Association are absolute garbage. If you go to the American Diabetes Association website and you start to look up some of their meal suggestions and their recipes, they're full of carbs. They're what you would give a person if you wanted them to be dependent on insulin for the rest of their life. They're not what you would feed a person if you wanted to get them off of meds and get them to lose weight and decrease their insulin resistance. So that's what's so frustrating about this is it is a complex problem. There is a problem with people's motivation, but then the people who actually are motivated are absolutely set up for failure by these establishment systems. They're told to eat the wrong things, and it's so frustrating because this is something that affects so many people. I mean, what did we say? 200 million prescriptions are written per year for statins. And
I want to add to that, if you don't mind. It's a feedback loop. I mean, it's a feedback loop. It's a basic circular pattern where why would somebody want to put the effort in of exercising, diet change, when our culture does not feed into that? And further, my doctor is telling me I have to take this pill and that I'm going to be perfectly fine. Why? Path of least resistance automatically goes. And then you add in the fact that if you try to get rid of the pill, you're told that you are going to die and that studies show that you're going to die because you're just not going to be able to control your cholesterol because, like Nicole said, they keep, quote, moving the bar, moving the goalpost on those cholesterol levels to where you need a statin and we're just going to put it in the water, like it's insane.
It is insane. And we don't want to be those people who complain without offering solutions. So we've dumped on statins. We've dumped on the dietary recommendations from the health authorities. When we get back from the break, we're going to give you some questions that you can ask your doctor. We're going to give you a variety of actionable things that you can do. So stick with us, and we'll be back after this break.
If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreitfetter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com.
Welcome back to Nurses Out Loud here on America Out Loud Talk Radio. We really appreciate the America Out Loud network because they don't censor us. They don't tell us what we're allowed to talk about. They don't delete things that we try and put out in the public, unlike all the big social media platforms that we have accounts on. So thank you to America Out Loud for being awesome sponsors. Visit americaoutloud.shop to check out some of the products that are represented by the network, and go find the nurses on americaoutloud.com. We have continuing education credits. We might have to do something on cholesterol or statins or do something like that. I feel like this is I feel like there would be value in that. So prior to the break, we were dumping on statins and we were dumping on the dietary guidelines that would only further heart disease if you follow them. So we're going to talk about some different things that you can do, and I'm going to start with labs. Nicole brought this up. They do a set of labs on you, and then you are plugged into the algorithm, and they're like, well, look at your cholesterol. You need to be on a statin according to the standards of care. Of course, the standards of care are written by predatory corporations and complicit agencies, and they are a bunch of BS. They keep lowering what is considered a normal range for your cholesterol because they want to sell more statins. These are the most common medication class in existence. And guess what? The risk-benefit analysis is garbage. If your doctor is trying to push them on you, one of the things that you can ask them is, for me, for where I'm at in my health right now, what is the number needed to treat for taking a statin? This is something that your doctor should know. This is something that they are trained to be able to answer when they're in medical school. This question cuts to, what is the risk-benefit analysis of this medication? Is this actually going to help me? And what we're looking at with statins is, how many people need to take a statin in order to prevent one heart attack? That's how we're sold on them, right? We're told you need to take this medication or you're going to get a heart attack. So how many people need to actually take a statin to prevent one heart attack? And the answer to that is something like 70, although I think that all that research is basically based on fraud, and I don't believe it. Don't take this as health advice, by the way. It's probably a little late in the show to give this disclaimer, but nothing we say, don't stop your statin cold turkey, talk to your doctor before making any big decisions, blah, 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 all those things. don't send your lawyers in our direction. We have no money anyway. We're not paid to do these episodes. So, all right. This comes up a lot in the carnivore community, people's labs, people's cholesterol levels, because people who are eating carnivore, a lot of them are getting about 70% of their calories from fat. And people's immediate thought is, oh my God, you're going to die of a heart attack. There are far, far better predictors of bad heart outcomes than your cholesterol level. This is one of the things that got Dr. Ovadia really thinking about his practice as a heart surgeon. Is he was seeing all these people on his operating table who were taking their drugs and had normal cholesterol, and he started to ask questions and dive into this. So if you're in a position where you're worried about your heart health, or your doctor is worried about your heart health, there are a couple tests that you can request. They are cheap, they are easy, you should be able to get them if you request them. One of them is your coronary artery calcium, your CAC. This is a number. The best score you can get is 0, and a higher number indicates more of a risk of a cardiac event. So many people who have been doing carnivore for a long time have a CAC of 0. Many of them have actually had their CAC lower over time, which isn't even supposed to be possible. This is a far better predictor, and you can ask your doctor to have this measured and then have that conversation about a statin after you get the results back. And the other lab that you can ask for is insulin resistance. This is different than a fasting insulin. Insulin resistance is such a driver of so many different health conditions, whether it's diabetes or heart disease. It's hard to find a chronic health condition that isn't impacted by insulin resistance. So this is another thing where if you are eating a lower carb diet, something like keto or carnivore, this is something that is reversible. And you get to do it by eating the most delicious foods in existence, like steak and bacon. So I'm going to ask Nurse Nicole for some feedback on that, because she has a bit of a different way of eating than I do and the communities that I hang out in. So what's up, Nicole?
I love this. You're the yin to my yang. So for those of you that don't know, Brave Dave is a carnivore through and through, and I happen to be vegan. So totally opposite ends of the spectrum. And although for those of you that have seen me, I am not, the thinnest little thing. I do have most of my diet around like legumes and, leafy vegetables and different sources of protein that some people would shy away from or think are not as appropriate. Nuts, seeds, like I said, beans, sometimes like tofu products or tofu and different things that I can see Ashley's face. And Dave are like, ew. But I will say, with the exception of my cortisol and my insulin because of stress, most likely related to the job and just all the things that I've done, usually my issues in blood work are not from my diet. Like it hasn't shown that I have like high cholesterol or anything like that. Even though genetics also plays a role into that, and I'm Italian, and just one of those things that we have. So I do think that it can vary, and that what works for one may not work for others. And why I think it's really important that we meet the patients where they are. There are people that have tried a vegan diet and have felt absolutely awful. There's people that have done carnivore and thought, this was going to be their ticket, and then maybe just didn't feel like it is the best for them. So I think that's a really interesting contrast between Dave and I. When you look at us, we don't look like we're sickly. Like we both have, we're glowing, and our health is pretty good. So I do think that that's important, because diet, they'll say 75% of these heart attacks are caused by some sort of cholesterol blockage, but also too, there's a lot of things that can be caused heart attacks wise from blood clots. So it's not just cholesterol, although they will push that as the only thing and why they're pushing the statins, but diet and how you take care of yourself are literally the top things that you can look at and try to manage to decrease your risk of heart attack, stroke, obesity, etc. And I think for some people, you can do that with different diets. It just really kind of depends on a multitude of things, what makes you feel good and how and what things are working for you. So I happen to be the complete opposite. And so far she's hanging in there doing well.
Ashley, can you we should have done this in the beginning, but just give us a brief overview of cholesterol. We talked about being reductionist. It's not that these heart attacks, it's not that cholesterol doesn't form clots, but can you speak to other things that cholesterol does in the body and how we shouldn't just simplify it by thinking of it as this villain?
Yeah. God doesn't make mistakes. I don't know if I've ever told you guys that or not, but God doesn't make mistakes, so just say it again. Cholesterol is a key component to everything. We think about our bodies from, our cells require cholesterol, our myelin sheath, which is like the coating of all your nerves, is made of cholesterol. You think about your brain, it's made of cholesterol, all your sex hormones driving, everything, like the cyclic rhythm of our body is all using cholesterol. And so it is a vital part of our bodies and our makeups. And so you have to have cholesterol. You fall below a certain point of body fat. If you're a female, you're not going to menstruate. This is a very serious thing. And this brings up a lot of issues. So cholesterol is essential. You're going to see different lab values. I always remember HDL, H healthy, L, DL, lousy. Lousy is your bad cholesterol. But the thing that kills me about this, and I didn't learn this until much later in my career, do you know what the defining factor is between healthy and bad cholesterol?
I mean, it's their density, right?
It's the direction in which they're going from the liver. So if it's going out, it's bad. If it's coming in, it's good. So it's the way that the liver and the body is using your cholesterol. Well, if you have more cholesterol going out to your body, it's a sign that your body needs that. Is it because you're burning through it and using it? Is it because of the fact that, your blood vessels are being damaged by either high blood pressure or insulin, which is just going in there, maybe spike proteins, who knows, and shredding the inner lining of your blood vessels? That causes damage, that causes cuts. And you think about, I don't know about y'all, but we have really rough roads here in Indiana because of potholes. And when you're driving along, you get caught on those potholes. The same thing kind of happens with your blood cells, like the little particles floating around in your bloodstream. And so what your body does is it takes this cholesterol and it just kind of puts you a patch. Well, over time, those patches build up. And if you look at in the heart where these blockages tend to be, it's in the narrow places, or it's in places where the velocity of the blood is moving through rather quickly. And so your body is just simply trying to protect itself from having breakdown of your blood vessels, excuse me, and your blood. Because if your blood cells are damaged or the proteins floating in your blood, you're not getting what you need, and the purpose of your blood. So that is important to think about. Those imbalances are telling you something. Your body is sending you a message and it's asking for help. So what do? We lower the cholesterol and don't give the body what it needs. Is that going to help things? No, it's not going to help things. So we go back and we look at this and say, okay, are we not getting the right types of the healthier fats? Are we pumping our bodies full of sugars? Like, what is going on that's causing this flow of fat to be this way? Your body will produce cholesterol if you're not taking it in. And so it's absolutely wild to me. And your liver function is huge. It's such an important part. So if you are dumping toxins in your body and your liver is not able to process these cholesterols, then you create a whole nother problem. That's why we used to see that just alcoholics had cirrhosis. And now, like, non-alcoholic cirrhosis of the liver, or what do they call it? I can't remember what they're
the fatty. Well, yeah, I know what you're
fatty
saying.
liver,
Better
but they're
living.
calling it something else. They're giving it a new name. Because everybody's liver is fatty. And I think that part of that is because of the toxic burden in our bodies. So there, it's just
so cholesterol isn't just gobs of butter floating around in your veins, clogging things up. It actually does more in your body than kill you. That's
no.
I don't know, Ashley. We're not going to sell as many medications if that's.
It's a mix of cream cheese and butter, actually.
Yeah.
But you know what's crazy too, and Ashley maybe can attest to this as well because we both work in cardiac. But how many times, especially in the program I run, do we see people that are like thin, fit, whatever, and they come in and it's like, oh, you need a quadruple bypass. And then we've had people come in with a heart attack that are like severely morbidly obese. You're like, oh, all day this person's about to be set up for a cabbage, and they're like minimal minimal cholesterol, their EF is good and everything, like the way their heart functions, and you're like, well, that's bizarre. So what I'm bringing up is that just because you look at someone does not necessarily mean that how they look is going to portray maybe what's going on the inside. It really can vary for a lot of people, and there can be a huge misconception that if you're overweight, obese, and large, that you may have all this blockage in you, or full of cholesterol, when that's not always the case. And same with people that are active and thin, sometimes they have that as well.
Yeah, runners used to come in all the time and it would blow everybody away.
So you can be fluffy and healthy. I guess it speaks to just how important individualized patient care is, and how everybody is unique and needs to be treated on an individual basis. And that's what we used to do. And now everything is protocol driven. Now everything is, follow the standard of care. You get plugged into the algorithm. And that, individualized practice is really taken away from our doctors, because none of our doctors are an independent practice anymore. It used to be that the doctors working in the hospital, they had a contract with the hospital, but they were independently employed. They were getting to do their own thing there. It wasn't hospital administrators telling them what to do. It wasn't the federal health agencies telling them what they had to do. They got to choose based on their clinical experience how they were going to treat patients. And that system is long gone. And I think it's gone because, it doesn't make as much money for the predators that we have running the show. But I don't want to get too off topic on that. So bringing it back to cholesterol. Ashley, thank you for that very informative rundown. As I understand it, and you said this pretty well, the cholesterol is responding to damage in the arteries, and the problem is not the cholesterol. The problem is the damage. So what is causing the damage? And I think all too often what we're finding out is it's what we eat. It's things that cause leaky gut. It's toxins that we're taking in. It's things like spike protein that's causing this widespread systemic damage that cholesterol is pulled to fix. And this really started to stand out to me when I would go to conferences that were centered around keto and carnivore ways of eating, and just talked to person after person after person who was switching to that style of eating in order to address an autoimmune disease. And the autoimmune disease was causing systemic inflammation. And for them, their specific disease, a lot of the times it would be Crohn's or IBS, and it was manifesting in their GI tract. But these people had issues with inflammation throughout their entire body. And when they got their inflammation under control, all of a sudden their heart health would start to improve in measurable ways, like coronary artery calcium, like insulin resistance. People would go from being insulin dependent to being off of all diabetes meds from changing what they were eating after they stopped following the standards of care, after they stopped following these protocols that the hospitals put you on. They're able to graduate from being on any of those medications. But Ashley, you look like you had something to say there.
I think that we run the risk, and I'm not trying to play peacekeeper. I am trying to keep my title as omnivore here. But I think when we talk about these things, we have to be very careful, because there are some people who cannot digest meat well, who cannot have those regular bowel functions, and there are nuances to these diets that you really need to be knowledgeable and understand. I, for one, my body does not handle legumes. So if I tried to go vegan, I would be like an inflammatory mess. I'd probably swell up and be whining and complaining in the corner somewhere. So I think we got to go back to, yes, cholesterol is absolutely part of the problem, but it's the symptom. It's not the cause. And so dialing things in for you where your issues are, and I've absolutely seen people go carnivore and, much to many people's surprise, reverse a lot of health conditions across the board. And you talk about, even I mentioned the myelin sheath of the neurons. We're talking about neuropathy, even reversing. Like, that's insane. But they're also controlling the sugar level. So you can do a vegan diet and you can eat like poo and take in all these super refined carbs and sugar, and you're going to feel like manure, you know? So I think we have to be very careful. Like, yes, there is a place for each of these things, and we really need to get down to that individualized care, get in with a practitioner that's not just going to say, well, I'm going to start you on X, Y, and Z supplements, and we're just going to do this. No, let's look at your diet. Let's look how your body is processing things. Let's look and see what your labs are saying about your digestion, how you're able to effectively use these nutrients, and dig in there, because I feel like we just run this risk of oversimplifying or using this reductionist, and either one of you could be right, given the patient. So,
Nurse Nicole, I'll give you a chance to respond.
No, I mean, I that's what I was saying, right? It's not as I always say, medicine is not a one size fits all. There are a lot of differences and nuances that I think we tend to overlook as a healthcare field, where, we try to put everybody kind of in the same box, or, oh, this is what works for majority, so we should just, try that with you. And I think the longer we go into this, we are finding that more often than not, people are not fitting in that box. And it is definitely looking different for people. And so, going back to the statins, I have so many cardiac patients that are on it and they are miserable, and they'll tell you that their legs are hurting. And then we run labs, we find out they're in rhabdo, meaning their liver and their body's breaking down. And all these things are happening. And the doctors are like, well, this is really the best. And, meanwhile, we're not talking about diet. We're not talking about possibly looking into fish oils or different things that could possibly help. And so I just think that, a lot of times we need to look at the bigger picture and understand that, like you said, Dave, it's individualized care. We might have to scale back on some of these things and try different things. And that's part of the frustration, right? Is finding the root cause, what works for somebody, and seeing how we can fix that and tailor it to their care. Because it's just not as simple as, like, Dave, you're going to do carnivore, I'm just going to do vegan, and Ashley's going to be omnivore. And obviously we all have different body types and we look different, and our labs are going to be different. And is that right? Is that wrong? Is it what's best for everybody? And so I think it's really important that it is tailored, and that we look at these individuals and address it accordingly. And because we don't do that, this is why so many people don't trust Western medicine. This is why they don't trust the physicians. This is why we don't have good working relationships. This is why the doctors are frustrated, because the patient's looking at you going, I'm not going to change my diet. I'm not going to work out, but I need to be fixed. And so they're like, well, here's a pill. And it just creates this, rat race of sick healthcare. And there's really no solutions. And why I think we are, dying from heart disease is number one in the United States. We've got strokes, we've got cancers, there's all these toxins and everything. And so again, it's just not really tailoring it like we should. And I think that's what's causing a lot of our issues.
Well, I think the lesson there, and this is a theme that applies to a lot of the shows that we do, is beware of the people who have a simple answer that they are selling you. It's never that simple. And when they present it to you in that way, it's because they're trying to make money off of you. And yeah, things need to be individualized. And you really need to take ownership of your own health, and you really need to be informed. You really need to be in tune and mindful with your own body, because what's right for you isn't going to be what's right for someone else, and you're both going to change over time. So those mindfulness skills will always serve you well. Back to the topic of statins, I want to bring up a personal anecdote because my father-in-law, Amy's dad, has been on statins. He actually had a heart transplant about 12, 13 years ago. So of course he's on statins. He's run into some other health issues recently that have landed him in a couple different hospitals, a couple different clinic appointments, and his statins have become a huge sore spot in this entire experience. They have become a sore spot because of the side effect of brain fog. He was becoming less responsive, he was sitting there mute, and he was not interacting with people. And he had other health conditions going on. People thought, well, maybe it's a UTI, that sort of thing. And what was discovered was that it was his statin. When his statin was stopped, he cleared up almost immediately. And it wasn't just this one-time anecdote of that happening. What happened was all these systems, all these different places and these different doctors, they do not communicate with each other. They're all in the same little geographical area, but they're all running their own software. They all have their own systems. They all have these outdated med lists. And his statin kept on getting restarted over and over and over. It was incredibly frustrating for the family because they would go in to visit him in the hospital, and he had been chatty and his normal self the night before, and all of a sudden the next day he's sitting there mute. He's staring off into the distance in a haze, and he's not interacting with everyone. And they come to find out that the hospital was using an outdated med list, and he was given his statin the night before. They had that experience over and over to the point where they put statins on his allergy list. And guess what? The next time he was admitted, he was still giving a statin because these systems don't talk. And we've talked about these communication barriers. You know, here we are in 2025. We have electronic medical records. We have all this technology. And I kind of miss the days of paper charting when everything was on paper. Like, seriously, how is this our system? How are things still this bad in 2025, where two different doctors that are 20 miles apart are constantly in a war changing people's prescriptions and nothing gets communicated forward? And there are all these incredible barriers, and it has real profound impacts on people. Either of you have experience with brain fog from statins? Yeah, you're both nodding. Who wants to go?
Yeah, actually, I have a lot to say about that because I have been advocating for a patient, and it has been absolutely wild to see how much these statins impact memory. And unfortunately, you know, it's not just the statins, because the statins cause a lot of inflammation. They cause, you know, muscle weakness, and our patients complain about these things all the time. But what's even more terrifying to me is these patients get moved from these statins, and, you know, they're failing treatment. They're cycled through every different statin that's out there, and they go to the next level. And I had a patient that I was advocating for who started on Repatha, which is a monoclonal antibody. And I think a lot of people are more comfortable with monoclonal antibodies, and they don't recognize. But unfortunately, he was having some pretty significant symptoms, and again, brain fog. And we think about this in what I said earlier about how our brain is mostly cholesterol, how our myelin sheaths are made up of cholesterol, how our hormones are driven by cholesterol. And unfortunately, this patient was having serious brain fog, but also memory loss and exhibiting some Alzheimer's-like symptoms. He actually shared that he had lost his girlfriend in the grocery store, and she was actually right behind him. He didn't recognize her. He went on to share about how he was really struggling because of the fact that he was starting to become more aggressive. And that is a huge issue, especially for men. And this patient happens to be very large. I mean, very strong, very active. And he's telling the provider hey, look, I'm afraid I'm going to hurt somebody. I'm getting so agitated that I could just, as big as I am, I could just take him out. And the provider is basically bullying him, saying, well, if you don't do this, you're going to die. We can move you on to this next medication, but it's kind of experimental and we don't know a whole lot about it. It's super expensive. And so, at that point, you just have to say, are we really doing this for the patient? Should these cholesterol levels in everybody be this low when we're exhibiting these symptoms of brain fog? Is this because we don't have enough cholesterol going out to, maintain that brain? It's very difficult.
Well, I mean, I know we're about to wrap it up, but essentially, we just need the listeners to understand that just because it's the protocol, just because it's the standard of care, just because you're being told, by someone that this is your only option, do your research, know what you're getting yourself into. You want to have as much information before you start something so that you can be aware and know what to look for. You want to, weigh out your pros and cons, your risk versus benefit. And you also need to know that there's always an alternative. Now, is it the best for you? We can't answer that, but there is always another answer, and that it's okay to say no. You know your own body. If you are started on something and it is not setting well, if you notice a change or your family is telling you something is off, listen to your gut, because we don't want you to necessarily stay silent or have someone tell you, oh, well, that's part of the grace period. You need to let it build up in your system. Give it a little bit of time and we'll see if those symptoms subside or pass, which is typically what they're going to tell you with any kind of medication, not just statins. If it's not working for you and it's not getting better, speak up, say something, and have that conversation with your physician. And they should be willing to do that, to do what's best for you, even if it goes against their original recommendation.
Well said, Nicole. That is all the time we have for today on this episode of Nurses Out Loud. I feel like, once again, we were just scratching the surface, and there's definitely more to this topic to unpack. If you want to hear more about it, you can look up the other nurses on social media and share, subscribe, do all the things. Until next time, this has been Nurse David Wayne, Nicole, and Ashley.
Shining light into darkness, thank you for tuning in to Nurses Out Loud.